midwifery কোর্সের তৃতীয় বর্ষের সাইকিয়াট্রিক নার্সিং সাবজেক্টের সকল এমসিকিউ সমাধান। প্রথমেই সকল বেস্ট আনসার। 1. কগনিটিভ ডেভেলপমেন্ট বলতে কি বোঝায়? সঠিক উত্তর থট। অডিটরি হ্যালুসিনেশন হিয়ারিং ভয়েস হুইচ ইজ নট রিয়েল। এটিওলজি অফ ডিপ্রেশনের এটিওলজি কি? সঠিক উত্তর স্ট্রেসফুল লাইফ ইভেন্টস। Problem with arithmetic and grasping mathematical concept refers to dyscalculia, that mathematical problem সমস্যা হলে এমন প্রবলেমকে ডিসক্যালকুলিয়া। A good psychiatric nurse need to be empathy. The major mental health problem in old age এ মেজর মেন্টাল হেলথ প্রবলেম হচ্ছে ডিমেনশিয়া, যেটাকে স্মৃতিভ্রংশ বলা হয়। Delusion is false belief. Which is the anti-anxiety drug? সঠিক উত্তর ক্লোনাজিপাম। Mentally ill patients are treated by psychotherapy. Full meaning of OCD, obsessive compulsive disorder. Common risk factor for suicidal tendency is schizophrenia. Growth hormone effects on behavior. Component of nurse-patient relationship, therapeutic use of self. Common phobia is exam phobia. Moral behaviors of a psychiatric nurse is empathy. Hallucination is a disorder of perception. In depression, there is a deficit of 5A's, serotonin বলা হয়। Abnormal interpretation of an objective is illusion. Who is the founder of psychiatric nursing? সঠিক উত্তর Hilkert Peplow. Significant criteria to diagnose mentally ill patient is mental state examination. World Mental Health Day is observed on 10th October. Schizophrenia means split mind. Obsessive compulsive disorder is repeated impulsive thought and action. ECT is mainly used in অর্থাৎ ইলেকট্রোকনভালসিভ থেরাপি দেওয়া হয় ডিপ্রেসিভ ইলনেসের জন্য। Multiple choice question. Branches of psychology includes general, cognitive and developmental. Phases of nurse-patient relationship include working phase and orientation phase. Etiologies of dementia are aging, vascular deterioration and alcohol toxin. Suicidal tendency common in manic depression, schizophrenia and obsessive compulsive disorder. Components of therapeutic relationship are avoiding, empathy and caring. Orientation phase include establish trust, acceptance and determine patient's need. The stage of counseling process are building stage and terminal stage. Positive symptoms of schizophrenia: hallucination, catatonic behavior and disorganized speech. Psychiatric nursing process consists of assessment, implementation and planning. Suicidal tendency is common in manic depression, schizophrenia, OCD, obsessive compulsive disorder. Florence Nightingale emphasized on holistic care, custodial care, and therapeutic communication. Symptoms of psychosis: catatonia, delusion, hallucination. Good psychiatric need to be patience, critical thinking, and good judgment. Phases of nurse-patient relationship includes working phase and orientation phase. Symptoms of mania are dramatic and insomnia. Process of nursing: assessment of mentally ill person, psychosocial assessment, history taking and laboratory test. Components of therapeutic relationship: professionalism, empathy and caring. A good psychiatric nurse to patients, good judgment. Common abusing substance is cocaine and alcohol. The major mental health problem are severe depression, mania and schizophrenia. Illicit drugs are heroin, crystal methamphetamine and cocaine. Signs symptoms of substance: poor physical, bloodshot eyes and following are causes of schizophrenia: genetic, the brain. Complete ECT are poor physical activity, poor communication, and confusion of psychosis. Suicide includes it's a psychiatric problem, may result from major depression, drugs and psychotherapy may be needed. Predisposing factors of mental illness are genetic factors, developmental problems of brain and sensitive to human emotion. Early warning sign of mental ill person includes insomnia and anorexia, extreme fluctuation of mood and excessive fear and tension. Antidepressant drugs are amitriptyline, serotonin and chlorpromazine. Child's psychiatric disorder are autism and attention defect.